Assalamu alaikum. Myself Shahriar Mohammad Sohan, Masters first year first semester session 2020-21. Today I feel very much happy about this presentation because this is our first presentation in Masters, and for this I would like to give thanks to our honorable course teacher, Bidut Kumar Sarkar sir, for arranging this presentation. Today my presentation topic is the use of racial categorization of medicine. Under this topic, I will discuss about the definition of racial categorization, racial groups all over the world, purpose of racial categorization of medicine, the use of racial categorization of medicine, and finally, the common drugs require racial categorization. First, we need to know what is racial categorization. Racial categorization is a process of grouping human populations in society based on their physical characteristics, such as his or her skin color, hair color or type, and facial features. Sometimes the terms race and ethnicity are often used interchangeably, used in a manner that both are same, but there are differences between them, such as racial categorization is mainly done based on primary continent of origin, such as African American or Hispanic, where ethnic categorization is mainly done based on genetic variations, genetic polymorphisms, etc. Now I will discuss about racial categorizations all over the world. Different racial groups and ethnic groups are existing all over the world. Among them, the most common racial groups are white, black or African American, American Indian, Asian, Caucasian, Hispanic or Pacific Islanders. Here is a figure which shows the different locations where different ethnic groups exist in the whole world. Now, the purpose of racial categorization. Mainly, there are two main purposes of racial categorization. The first one is ensuring effective medication, and the second one is appropriate dosage adjustment. Ensuring safe medication is required because the agent may not be as effective for a racial group as for other groups if the same group is prescribed or given the equivalent drug. Again, the dose optimization is necessary because dose optimization is required because the same dose may show varying degree of pharmacokinetic or pharmacodynamic properties in the different ethnic groups, which may ultimately result in or produce overdosing or underdosing of the same medication. Now come to the use of racial categorization of medicine. The first use is the characterization of the risk factors of the disease. In the whole world, human population is not homogeneous to the risk factors of the disease. That means each individual patient has selective risk factors of developing a particular disease, which could be different from others. Thus, identification and characterization of these risk factors for individual people of disease is the first and foremost function to provide the best treatment. The second use is designing an effective plan for reducing the adverse drug effects. In Britain, approximately 7% patients in hospital have to face drug reactions. Ethnicity is major factors implicated in drug reactions, such as angiotensin converting enzyme. We know a common drug, these angiotensin converting enzyme inhibitors, which cause angioedema in the black patients more comparatively with the white patients. Again, it produces cough to the East Asian patients compared with the white patients. The third use is development and selection of the best treatment strategy. Here is an antigen known HLA-B1502, which has an association with the Stevens-Johnson syndrome produced by anticonvulsant drug carbamazepine in Han Chinese population. But in another study, it has been seen that this Stevens-Johnson syndrome was not produced in the East Asian region people, though they were used carbamazepine, because these East Asian region people did not have HLA-B1502. So the finding of these genetic markers is a significant parameter for dose optimization and developing the personalized based treatment strategy. The fourth use is implementation of individualized therapy. Identifying and characterizing all risk factors will help us moving closer to the individualized therapy. The fifth use is identifying the variation in drug metabolism. The main cause of variability in drug metabolism among different ethnic groups are differences in distribution of polymorphic trait and mutations in the gene. Such an example of gene is CYP2C19. If this metabolism is altered, then the toxicity will be produced in different ethnic groups. The last point is different drugs which produce racial, or which require racial categorization, such as the cardiovascular agents, central nervous system agents, analgesics, antihistamines, and alcohols. With this, I complete my presentation. Thank you all. Assalamu alaikum.